told you that, huh?
Because none of them have masks on.
Good afternoon, ladies and gentlemen. We're ready to begin this afternoon's special board meeting. The special school board meeting of September 1st, 2020 is now called to order. The time is 1:02 p.m. We would like to take this opportunity to remind the members of the public of the district's mission, which is to ensure that each student achieves his or her highest personal potential, and the district's vision to be a world-class school system. This afternoon's agenda includes 2 items under staff presentation to the board, public comment, 1 item under superintendent's recommendation, and 4 items under other business. Board members, is there a motion to adopt the agenda? Moved by Ms. Vaughn and seconded by Mrs. Morgan. Please record your vote. Motion carries and the agenda is approved. This afternoon, we have staff presentations to the board on policy 1.181, emergency requirement for protective gear, and then student face covering presentation. We would like to hear both presentations and then follow with questions by the board. At this time, I'll turn it over to Dr. Atkins. Did you want to introduce this afternoon's presenters?
I'll just turn it, thank you, Madam Chair. I'll just turn it back over to our board attorney, Kathy Dupree-Bruno. She's going to lead the presentation, and then our staff will come up and provide you with a PowerPoint presentation.
Thank you. Attorney Bruno.
Thank you, Dr. Atkins. Thank you, Madam Chair. At this time, if we can have the presentation on Board Policy 1.181, Emergency Requirement for Protective Gear. Board members, the policy that is being presented is to confront any type of health emergency dealing with infectious diseases or a pandemic, as we are experiencing now with COVID-19. It is to cover any future pandemics or infectious disease or emergency health crises that we may face in the future. Basically, the policy states that we will follow the Federal Centers for Disease Control, the State of Florida's Department of Health, and any local health officials with regards to guidelines and directives for the safety of our students, staff, and the public. The policy says that guidelines will be implemented, and the guidelines will be generated by the superintendent, and all individuals entering school board property shall abide by the guidelines established. In March of 2020, Governor Ron DeSantis declared a state of emergency for the state of Florida based on the novel coronavirus disease 2019, commonly known as COVID-19. On July 20th, 2020, Dr. Scott Rivkees, who is the state Surgeon General, issued an advisory that basically recommended that all individuals in the state of Florida should wear protective coverings over their nose and mouth, and that all businesses and organizations should encourage individuals to wear those protective coverings. The next slides are from the Center for Disease Control and discuss the coronavirus 2019 outbreak. Pursuant to the CDC, the virus is not like a normal coronavirus. It is not like the common cold. The virus is very highly contagious. It is spread by people who do not have symptoms and who do not even know that they are infected, as well as those who are infected and have symptoms. It is spread by respiratory droplets released when people talk, cough, or sneeze. That is why there is guidance to social distance at least 6 feet apart, to wear masks in public settings. The CDC indicates that masks provide an extra layer of protection from respiratory droplets from traveling in the air onto other people. The CDC calls on Americans to wear masks to prevent COVID-19 and the spread of COVID-19. The Florida Department of Health, under its public health advisory, has recommended that residents are advised to wear face coverings if social distancing is not possible. We received correspondence from our local Department of Health reiterating Dr. Scott Rifke's, the State Surgeon General's public health advisory to wear masks or face coverings, as well as included in the letter was an explanation about the spread of COVID-19 from person to person through droplets. Island Coast Pediatrics, Physicians Primary Care of Southwest Florida, and Lee Memorial Hospital and all of its physicians also have taken the stance that everyone should wear masks to prevent the spread of COVID-19, including children. The CDC's position is that wearing a mask protects others. The Surgeon General of the United States, Dr. Jerome Adams, made a statement pleading with Americans to wear masks to prevent the spread of COVID-19. Ms. Schaefer is going to play a video.
And number 3, know how to stay safe. And that includes everything from making sure we're taking basic precautions to staying home if you're at high risk or you're going to a high risk place. The fact is, we're seeing an increase in cases and an increase in hospitalizations in those under 40. So we need everyone to follow our preventive guidelines. Stay home if you're sick. Stay home if you're vulnerable. And again, we know people are more vulnerable as they get older, but they're also vulnerable if they have hypertension, diabetes, and obesity. Wash your hands or use hand sanitizer frequently when out. Maintain 6 feet of distance between you and others when you're out. And please, 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 wear a face covering when you go out in public. It is not an inconvenience. It is not a suppression of your freedom. It actually is a vehicle to achieve our goals. It adds to your convenience and your freedom because it allows us to open up more places and it allows those places to stay open. When you do not wear your face covering, we end up in a situation where you see higher rates of disease spread and you end up having to close places. This mask, this face covering, actually is an instrument of freedom for Americans if we all use it. Young people, I just want to...
So under what statutory authority does the school board have to require protective gear pursuant to the policy that is before the board today? First, we look at Florida Statute 1001.32, which cites Article 9 of the state constitution, which gives district school boards the authority to operate, control, and supervise all free public schools. We then look at Florida Statute 1001.41, which states that the school board determines policies and programs for the efficient operation and general improvement of the district school system. Florida Statute 1001.41, subsection 5, also says that the school board shall exercise those responsibilities and may find it necessary for the improvement of the school board. So any responsibilities and duties they may exercise if they find it necessary. Florida Statute 1001.42, subsection 8, specifically addresses student welfare, and it advises the school board to pay proper attention to the health, safety, and other matters relating to the welfare of students. Florida Statute 1001.43, subsection 1, discusses student management and gives the school board the ability to adopt any programs or policies to ensure the safety and welfare of individuals, the student body, and school personnel. Florida Statute 1043, subsection 11, gives the school board the ability to adopt policies and procedures necessary for the management of all personnel. Florida Statute 1006.08 grants the superintendent the ability to make recommendations to the district school board for the attendance and control of students at school, for the proper attention to health, safety, and other matters which will best promote the welfare of students. There have been challenges to the mask mandates which the board should be aware of. First and foremost, Florida Statute 252.32, in discussing the government's responsibility, which will include the school board, is also to protect the public peace, health, and safety. The main case that everyone goes back to when we address these types of issues occurred in 1905, when the United States Supreme Court heard the famous case of Jacobson versus Massachusetts, 197 U.S. 11. This case involved a young man who was prosecuted because he refused to take a mandated smallpox vaccine. He claimed this was an unreasonable invasion of his liberty. However, the Supreme Court of the United States upheld the constitutionality of the immunization program as it had a real and substantial relation to the protection of the public health and safety. As of August 10th, 2020, there have been 4 Florida courts that have had an opportunity to review mask mandates. It's listed on the slide. All of those challenges have been defeated. In Power versus Leon County, the court stated that minimizing the spread of a deadly infectious disease is a compelling state interest. If the board approves the superintendent's recommendation as an emergency rule per Florida Statute 120.54, Policy 1.181 will become effective immediately and will be in effect for 90 days. We will then move forward with the rulemaking process, the normal rulemaking process, for a formal permanent adoption by the board. At this time, Madam Chair, I'm going to invite the Chief Legal Counsel and his team to present on the guidelines that the superintendent is recommending and has drafted for masks during COVID-19. While they're getting situated, we do have a brief video presentation.
This year, students are required to wear a face mask at school. Students who do not have a face covering will be provided one by the district. You can put on a mask by placing the loops around both ears and pulling the mask above your nose and below your chin. Masks help prevent the spread of germs, protecting all of us and keeping everyone safe. Students will be provided with breaks for removing their face covering, such as taking their mask off while they are eating lunch. And when they are doing outdoor or strenuous physical activities during PE and recess. Face bandanas are not allowed. And face shields are permitted, but must be worn with a face mask underneath. Neck gaiters are permitted, but must be double layered for proper protection. The School District of Lee County thanks all of you for your continued cooperation in keeping our students, staff, and community safe.
Good afternoon, board members, Superintendent Atkins, Board Attorney Dupuy-Bruno, and visitors and guests, as well as district staff. I'm Brian Williams. I'm the Chief Legal Counsel for the district, and I'd like to take the opportunity to present my team of attorneys, including Christine Schroed, who's our staff attorney for academics and student services, as well as James Holloway, who's behind me, who is the attorney for labor and operations. We're going to be presenting this as a team. That being said, Ms. Schroed will be taking the bulk of the presentation on our behalf so that we can have a consistent train of thought. What I'd like to do is have our entire staff here available to answer questions in the event those come up, because this policy does touch on different areas throughout the district, including employees, visitors, contractors, as well as students. That being said, I will now turn it over to Ms. Schroed, who will start our way through this slide presentation.
Thank you, Mr. Williams. Again, my name is Christine Schroed. I'm a staff attorney. I'd like to say good afternoon to Madam Chair, board members, Attorney Dupuy-Bruno, and Superintendent Atkins. It's a pleasure to be here to present this slideshow. So there's been a lot of discussion on face coverings for the school district staff and students. So I'm going to start off with the staff guidance. The staff guidance is that all persons, and that includes staff, vendors, volunteers, and visitors, must wear appropriate face coverings that cover the mouth, nose, chin, and fit snugly to the face when on school board property, at a school board activity, or riding a bus or other approved transportation. At this point, all persons are requested to provide their own face coverings.
19 p.m.
So the question is, what constitutes an appropriate face covering? What we're going on is CDC guidelines and recommendations, and here are some examples of the acceptable face coverings. We have the commercially produced face coverings, or masks, as they're known, or respirators. That would be your surgical masks, your N95 masks. What you'll more commonly see is the cloth face coverings. Our cloth face coverings must be at least 2 layers, and again, completely cover the nose and mouth and fit snugly to the wearer's face without any gaps. There is a great guidance on the CDC website about how to make your own face covering. You can do it with a sewing machine, you can do it without a sewing machine. So there's some really good resources on how you can make masks on the CDC website. Again, you can wear face shields, but they have to be worn in conjunction with a face covering. A lot of questions came up about beekeeper-style hats that are popping up on the market. As long as the shield is completely covered in cloth and it goes down and covers the entire head, that is acceptable. So just to give you a visual of the appropriate face coverings, you have obviously the cloth face coverings. A lot of people are making them at home, so that's a way you can make a fun pattern. And then you have your surgical masks and your N95, which I would be surprised if most people could get at this point, but those are all acceptable face coverings. So what is not an acceptable face covering? You see people with the open chin triangle bandanas. Those have a lot of gaps, so that's not appropriate. There's a lot of face coverings that have the valves or the vents. Studies have shown that that actually has the opportunity for droplets to escape, so those are not going to be allowed at this time. You have face coverings that are mesh. Those are obviously not allowed. They are porous and droplets can get through. Same thing with lace face coverings, any face coverings with holes, and again, that porous material. So if the gaiter is a porous material, it should be doubled up. So again, to provide a visual of examples of inappropriate face coverings, we have a mesh face covering. a lace face covering, the triangle bandana, and then the masks with the valves or the vents. So those are not appropriate. So a lot of questions have come up about exemptions based on disability. We are accommodating persons with disabilities, and they need to go through the process where they request a medical exemption. They would provide documentation from a licensed healthcare provider that they have a medical, physical, or psychological contraindication that requires an accommodation or prevents the person from being able to safely wear a face covering. We are following the same process as we do the ADA requests, and that would be submitting the request with your documentation through Human Resources, and then they would follow their current processes and procedures. So other exemptions that we have allowed for, if staff is in a closed space, such as an office, or when you're in an open space and you are sufficiently partitioned, so that would look like your cubicles that are sufficiently spaced, that would be an exemption. If a person is engaging in strenuous physical activity, inside or outside of any facility, they will not be required to wear a mask, but they will be required to socially distance, and that's at least 6 feet apart. Outdoor activities in recess, that's kind of a break. Again, you still have to socially distance. So we will be closely adhering to those guidelines. So next up is the student guidance. I think it's been a great success since school started. All the kids showed up with their masks. We haven't really had a lot of issues at this point, but our guidance is that all students must wear an appropriate face covering. Again, covers the mouth, nose, chin, no gaps, on school board property, on the bus. It is required. So we are asking that students provide their own face coverings, but we do have them if they are not available. We are receiving a lot of donations, and we will make them available to all students. Another big question is what happens if a student does not wear a face covering? We are trying to treat this as a health issue, not a discipline issue, and an opportunity to educate. So if a student is not wearing a mask, the first thing we want to do is talk to the student about why we're doing this. Why are we making everyone wear a mask? It's to protect the person who wears the mask and other people around them that may be exposed to the virus. Again, if the student doesn't have the face covering, it will be provided. And if the student refuses to wear a face covering, they will be isolated and the parent or guardian will be contacted to come pick up the student. If the student repeatedly refuses to wear a face covering, the student will be eventually enrolled in the virtual program. Again, we want to try to work with the student and the family in understanding the importance of everybody wearing a mask to keep everyone safe, and that's our first line. But again, there is that option if they don't want to wear the mask. We have several virtual options. So will students be provided with breaks? Again, going back to the staff guidance, students, especially your younger ones, are going to need breaks. And you know, they need to be supervised during those breaks, and they need to be where students can appropriately socially distance, and there's adult supervision, but each school will be able to kind of establish the guidelines by which breaks are given. And again, just like staff and visitors, we have the student exceptions to face coverings. We're again going by CDC recommendations. Children under 2 are not to wear face coverings. It is not appropriate. And anybody who has trouble breathing, is unconscious, incapacitated, or is not able to safely remove the face covering on their own, they will not be required to wear a face covering. Eating and drinking, obviously, you'll be able to take your mask down while you're eating or drinking. And again, every effort needs to be made to maintain social distancing during meal times. We also have, similarly, the exemptions based on disability. So students who are requesting those medical exemptions can do so through several processes. We have our students who are already identified as students with disabilities. They may have an IEP. So if there is a request to allow that student to have some sort of exemption or accommodation, then an IEP team meeting would be convened where the team would discuss what that would look like. It could be anything from an accommodation such as the student wearing a face shield to including goals and accommodations so that the student can increasingly tolerate mask wearing. So they might only be able to wear it for 10 minutes at a time at first, and then as we progress, we provide rewards for the times that they're able to keep it on longer. So almost like a behavior plan. So the goal is to get the students to wear them, but we do understand that there are certain students who may struggle with that. We also have our students who may have a medical condition, and they might already have a 504 plan, or they might request a 504 accommodation. And that will require medical documentation provided to staff at the schools, and then a 504 team will convene to review that information and determine whether an accommodation is reasonable or appropriate. And again, this slide touches on our ESE students. Again, we're encouraging them, we're educating them on wearing a face covering at all times, but the inability for them to consistently keep a face covering on will not prohibit their attendance at school. Alternate face coverings will be made available for students and staff who communicate with our deaf and hard of hearing students, or provide educational related services such as speech language, or any activity that requires a visual of the person's mouth. And that could include a mask with a clear panel on the front. And again, where possible, face coverings or face shields could be an accommodation in that instance. And again, this is a case-by-case analysis. Every student is different and every situation is different, so we really want to make sure we have all of the information necessary to make a legally sound decision. Again, we have the exemptions for strenuous physical activity. And again, we still recommend social distancing. And then outdoor activities in recess, that's the same. There are some activities that have their own guidances. Some of those: music, choir, band, theater, and athletics. Where the wearing of a mask is not practical, they will not be required to wear the face coverings. However, the students must still follow any specific guideline for that particular activity. So, for example, there's a fine arts guidance, there's high school athletic guidances. So that's the recommendation, is that each of those has their own guidance. So contact information. The Florida Department of Health COVID-19 call center has, you can call there and ask any questions. I just wanted to include some links. The CDC website that has all of the information on masks and the coronavirus. And then the School District of Lee County website also contains a lot of really great information on all of the safety protocols. So with that, if there's any questions.
Board members. Ms. Petrika.
Thank you for the presentation. I appreciate it. I dare you to say lace face coverings 10 times fast. So when we talk about, I appreciate that we're approaching this from a health perspective instead of a student discipline perspective. You say a student repeatedly refuses to wear a mask. What is repeatedly?
So that is where we have tried to work with the student, educate the student, and the student just says, I am never coming to school and I'm not, and wearing a mask. In that case, again, it is going to be escalated. It is going to be a case-by-case analysis depending on the facts and information that we're given. And if the student just refuses to wear a mask and can safely wear a mask, then they will be re-enrolled into a virtual platform.
So there's no magic number that we can rely on at each school?
I don't think there's a magic number per se. I would say more than 2 to 3 times is what we're looking at.
And Ms. Petrika, I mean, this is one of the things, like with any issue involving guidance that we provide our school administrators, be it the code of conduct or something very similar, there is a certain degree of discretion. And in a case like this is something, of course, where they'd be working with our school development team, before they'd make a final decision.
Okay. And then which virtual program is the parent going to be allowed to choose between LVS and LHC?
Yes.
All right, I've got a couple more. You said that a team is convened to determine the reasonableness of a request to not wear a mask. What authority, and authority might not be the right word, but if we have a medical professional who's saying this child can't wear a mask or this staff member can't wear a mask, what authority do we have to overrule that medical advice?
I think there's probably two sides to that, and I'll let Mr. Holloway address the staff side of that question.
Good afternoon, James Holloway again. As it relates to the analysis, there is...
Can you get closer to the mic, please? Thank you.
Yes, ma'am. So with regards to the analysis, the medical information that we will be provided will be balanced against whether or not it's an undue hardship for the district, meaning that we will provide any accommodation that we deem to be reasonable, which is the standard of law. However, the reasonableness of that accommodation is dependent upon a lot of circumstances. For instance, if this particular employee has a specified role that can't be somehow accommodated, or if there is something about the particular medical information that we can accommodate, we will actually do everything we can to go through that process and allow them to be able to do something that is reasonable and safe. So we have the reasonableness of the request, and we have the health, safety, and welfare of that particular employee, employees that'll be around that employee, students. So there's a lot of considerations that will come into play, and the committee will convene, address that, and we have an interactive process. So we won't just make a determination and give it to the employee and say, take it, it's our way or the highway. We'll work with them to see if we can do something.
Great, and I think that was well explained by Dr. Pruitt during bargaining too.
Right.
Okay.
And just to follow up with the student side of that, it's a little bit different of a process. A medical diagnosis alone does not automatically mean a student would receive an accommodation. For Section 504, the disability must cause a substantial limitation on the student's ability to learn or another major life activity. It's a case-by-case analysis, and the doctor's recommendation is absolutely a big part of that, but there's also staff members who would weigh in and determine whether that's reasonable.
Okay, I just have two more questions, if I may, Madam Chair.
Yes, ma'am.
So a member of the public wants to attend one of our public meetings, and they have a medical reason for not wearing a mask. How do we go about accommodating that?
Again, we would seek out to see if there's any alternative methodology that we can employ in order to allow them to be, in the building safely. We will address that issue in more detail depending on the circumstance, but it doesn't seem like there is an opportunity to be in a room without being appropriately socially distanced, and to keep everybody else in that room safe. So we might have to exclude that person from the actual in-person meeting. There's the alternative to allow that person to have some sort of virtual option in order to participate in the meeting, however. So we'll try that.
Thank you. And my final question, I think, might be for you, Attorney Dupree-Bruno. In terms of Florida Statute Section 1001.428A, it seems that we would be opening ourselves up for a lawsuit in violation of that section of the statute if we did not require masks because of all of the medical advice we have received to wear masks. Is that a fair?
That's a fair statement. Given the standard of care that's being established by the Centers for Disease Control, the Florida Department of Health, that will be something that could be argued.
Okay, and I think, Attorney Williams, this will be my last one. Attorney Williams, I think you talked once before about the possibility of a child or a parent on behalf of a child bringing a lawsuit because a child was harmed by wearing a mask, and I believe you said that that's a legal notion without any precedent. And
Well, again, to address the question, and similar to the responses we've been providing today, every situation is a case-by-case analysis because obviously it's been some time since we've had a pandemic of this nature, and to incorporate current existing laws as it relates to enforcing a mask policy is relatively new ground in terms of this type of situation. So we are evaluating everything on a case-by-case basis so that we can look at each situation from kind of a progressive approach. I think you saw that within our presentation, that we didn't simply say, here's a mask policy, take it or leave it. We said, here's a mask policy, but it incorporates situations that personally affect different students, different employees, different visitors and guests, different vendors. We're trying to be understanding of those situations, but we're also trying to put into effect a policy that's aimed at protecting everyone. And so with respect to a situation where someone raises a concern regarding the use of a mask having a medical effect, we obviously would look at the any medical information provided to assist us in determining, again, consistent with the policies and procedures we've established, whether or not that would be appropriate given the circumstance. And so I don't want to create a bright line test rule for that, but I want everyone to understand that we look at it from the health, safety, and welfare of all students, and then we try to address each individual concern that is brought to our attention. And I think that's the fair way to do it. It's also the safest way to do it in light of all the concerns that are expressed.
Great, thank you.
You're welcome.
Thank you. Ms. Vaughn?
First, I want to go back to something that Ms. Patrica just brought up. The statement, a student repeatedly refused to wear a mask covering, and she did ask for a number or a guideline. What I'm concerned with, and this is really an ongoing concern with me, is that I feel that we need to have some consistency, some standardization among our schools. It is my understanding that we already have principals that are saying, one strike and you're out. And we have other principals say, well, on the third time. And I would certainly want to see, not written right here, but I certainly would want to see guidelines and consistency at the various schools so that we don't have one person saying, no, it's my school and you do this once and you're gone, and others saying X number of times. That's a big concern that I have. So I just wanted to hear, has anything really more specific than it's up to you principals at your schools? Maybe that's for Dr. Atkins.
I mean, I can address that. I know that our school development team and we, as we talk to our school principals, have provided them, I think, a significant amount of guidance in terms of how we are to implement this particular policy. I don't want something that is just like a kind of one strike, you're out type of thing. I think there needs to be, this is an educational issue. I think I think we need to treat it that way. Tell on myself, I just switched out my mask, learning something real quick here in the presentation, because this does evolve. And I think we have to teach our students, as we move forward. So on the other hand, if we have a situation where somebody is just being absolute, I'm not going to do this, which rises to a level really of an insubordination and a refusal, that's a case where, I think that an appropriate change in model would come into play. We did have a situation, I know, at one of the schools I visited yesterday, where we did have a student that started out that way, but through an educational process, we had a student, really come into compliance with the current policy. That's the way we would prefer our principals handle these particular situations. So now individuals are different. They have different personalities, so that's where, some of this judgment comes into play. But again, we've talked a lot to our school principals, And we would expect them, as was this case, to work, with our team when making that final decision if you had to make a change in instructional model as a result of this.
Okay, yeah, and I'm happy to hear that because I think despite our best efforts at educating and having the students understand, especially the older students, of course, why they're doing this, why we're asking for them to do it. I don't want it to become a strict discipline, except if they're downright just refusing and insubordination, that sort of thing. So I'm glad, and hopefully the principals will understand that their leeway isn't huge and broad. Okay. The other thing that I wanted to say is, when we talk about the medical personnel, and I know it was just mentioned, well, who are we to, as a team, to question medical personnel? But what I'm afraid of is that this may turn out to be something like, the therapy animals, when people bring a rooster on a plane and they have a note from someone. I would like to see the language tightened so that it's a local, personal physician, because it's going to become a cottage industry out there for anybody with a medical license out on the internet to get these things. Just legally, what's your reaction to that?
I'll touch on that briefly, and then I think Ms. Schroed has something she wants to say. Again, we're establishing processes, hence the committee with the students in the 504, as well as the ADA with respect to employees. And we already had that ADA process pretty in place in terms of, and we're getting a lot of those types of requests. And it's a very fair process. The committee that's used to hearing these types of requests, one of the factors you actually have to consider is the competency of the medical professional providing that recommendation. So this isn't just, you can just grab someone that hasn't treated you for a specific issue and then you're able to opine on that, or if it's outside your considered specialty. There are different circumstances where that is allowed to be evaluated under the law. So it's not a circumstance where there's just anyone can write anything and it will be accepted. So we will definitely look into that, and I know we're taking notes here and as well in terms of the information you're providing, and this is why we open this up for discussion to ensure that we're getting as much feedback and incorporating as much thought process into these documents. And again, they're documents where we had to establish guidelines because we needed to give instruction to our school personnel as well as district administration. But we also know that with COVID-19, everything's fluid and everything is subject to some level of reevaluation in terms of improving the process moving forward. And that's all we're trying to do, is put a process in place that keeps us safe, but also takes into consideration all of our students, all of our employees, and getting somewhere where we can feel comfortable with what we're producing in light of the health concerns raised by the CDC and the Department of Health.
Well, and I brought it up because to me, the tighter the language is there, the less we will have to deal with, here's the note, this is a licensed medical professional. And, let's be honest, we know those people are going to be out there that will, for a fee, write an excused on a child. So those are my comments, I guess.
And I do think that's a valid concern, and that's why, guidance from the Office of Civil Rights, who's over 504, has said, it's not just the medical diagnosis that you look at. That's why you convene a team. You consider all of the relevant information and then make a determination on whether or not an accommodation is appropriate. Unfortunately, I think we are and may already have some of those types of form requests. Again, we're going to want to dialogue with the medical professional. They need to include information on why that's a necessary accommodation in the school setting. And the team might have additional questions for the recommending physician. So it really is a case-by-case analysis, and I think our teams might get busy this year, but we'll see.
Well, can we anticipate a turnaround time? Because I know a lot of these kinds of things, it takes like a month to get the team to meet. I mean, what, are we going to establish some guidelines? Because we do want to have a quick turnaround time, and we do want that child to have the best educational experience.
So Jessica Duncan and her team have prepared additional guidance on processes and procedures surrounding the requests, and I'm going to turn it over to her to answer that question.
So many of our teams spent the couple weeks before students came addressing many of those concerns as parents brought that paperwork beforehand. We did have a couple of requests the first day that teams worked to get together that team either the next day or the following day to address those really quickly, because obviously then the student couldn't be out in the general population without the mask. So those were addressed quickly. Along with what Christy is saying, we do have doctors who are putting in scripts right now that just say face mask exception. And historically, with special populations, we do get input from doctors, which we consider, but we do look at everything. So for many of our students, they either have a health care plan in place or something else that we look at in conjunction with that doctor's note. And then, like Christy was also saying, we also reach out to or work with our nurse at the school if nothing specifically is indicated in that note as to why in particular that student can't wear a face mask or what it would inhibit if they did.
Okay, great, thank you.
Thank you. Ms. Morgan?
Actually, Member Vaughn asked the question that I wanted to ask, which is the consistency of application across schools. I guess, so the only question I'm left with at this point is, how do we let parents know either do they go to the school or do they come to a district department? You know, how, if somebody wants, is this the COVID helpline? If somebody wants to ask questions about the process or how to appeal, you know, where is their information about that?
So if they go to their school, they would be referred to their equity coordinator, who would handle the 504 process. And then the team would be convened and they would be given procedural safeguards, which would include all of the information they need to understand their rights and appeal the process if they...
I get that, but who do they ask? What's the first step?
Going to the school with medical information.
Okay, so they go to the office, they go to the principal, they...
Correct. They can go to any one of those. They could go to their teacher, anyone at the school, and then that person would then refer that on to the equity coordinator.
So there's some place on the website or in the whatever that tells the parent that's...
There isn't anything specifically on the website for that, but they can call the COVID hotline or email the COVID email. So any question that comes through there, we can direct them to the appropriate personnel in their school and find out for them who they should talk to. Or in many cases, we actually do the actual outreach for them to connect the community member or the parent with the appropriate personnel in the school.
I guess my concern is that there's been a lot of circular conversation. You know, somebody calls in, they're referred to somebody else, the line doesn't get answered because of all of the communication taking place, and then people get frustrated. And so, you know, I'm just trying to figure out a way to make certain that people feel like we're not obstructing them, but we're trying to work with them, and that's really my concern now.
Right, and that's what I said. We actually would take the information and try to get with the school for the individual and connect them, so we don't want to just send them off to find out who it is. If we ask them the school name, like we'll reach out to the administrator at their school, and we've done that with face masks, computers, whatever the information is, we would reach out to the school directly in any instance where the parent wasn't sure who to talk to about anything with an IEP, a 504, any medical information.
Okay, let it go. Thank you.
And one more, and just to add, to that. I think we'll take that comment and circle the wagons, as they say, and revisit where we can promote that a little bit better and get information out to the parents.
Thank you.
Ms. Gittens?
Okay, good afternoon. First, I'm going to request, and this is kind of overarching, a lot of times we have presentations with slides, and on the slides that are on the screen, they have numbers. On the one that we have received previously, they're not numbered, and we can't manipulate the one on the screen. So what I'm asking is, when there are presentations, if we can have the numbers of the slides, so if we go back, we can refer to them, would make it easier. So first thing is, I think this would be for this team and probably Mr. Holloway, with the employees, who is the final word on staff issues like that? Is because there have been some situations, and do they go to, is that a SPALC, a calc situation, or what do they do if they're not getting remedy at their school?
So with most employee issues, they'll start out at the school site. School site has direction to speak with the district office. If they have issues, who they would deal with at the district office would be different depending on what the issue is. If it's an ADA issue, then there's someone over in HR that is the overseer kind of that committee. As it relates to misconduct or something like that, it will probably be our director of professional standards, and there are different subdivisions within that office. So what we will be doing is providing oversight and support to the extent that there is an issue that can't be dealt with at the site, if that answers your question.
Well, it does. The situation is, if there's an issue at the site and the employee does not feel that they have gotten an equitable remedy to the situation, they personally, I mean, I understand that the school is the first line of defense, but if that does not work for an employee, what do they do?
Correct. So what will happen is, if there's an issue as it relates to the mask, and at the site, we first are not going to start out with discipline or anything like that, so it shouldn't be much of a problem. We're going to start with education. So from there, we will probably have them review the policy. We'll have them review the superintendent's guidelines. We will have them review the CDC guidelines, and then we'll escalate that to the point where we will treat it as a request for an accommodation. So at that point, we'll go through the process to see if there's any alternative that we can employ that won't be a hardship to us, that would allow them to comply with the rules and keep everyone safe. From that point, it will go to a place where we may need to ask them if they want to have a reassignment, if that's available, and we have an opportunity to do so. Obviously, we'll be limited in our ability to do that. We might need people at school sites that can't go teach virtually, and so on and so forth as it relates to those issues. Assuming that part doesn't work, then we will ask the employee to take appropriate leave. Right. And if that doesn't work, we will consider whether or not we need to initiate the disciplinary process. And this portion of that consideration will be happening over with professional standards, and we will have that entire committee convened in order to have input.
Right. I just want to, make sure that employees feel comfortable that if they do feel they are not being answered, that they would be able to seek some remedy without reprimand.
And there is a more involved process in terms of what we do in terms of having oversight. For instance, there are different layers and determinations once we get into different processes, and as we escalate to different layers in that process, there are different people involved.
Okay, and I have one question about the union piece of it. I've heard this before, and I don't know if it's true, that even if you're not a union member, if it is a employee type situation, the union has to represent you as well. Is that not true?
Well, depends on the classification of employee. They're all governed by their respective collective bargaining agreement. That will lay out what any individual employee's rights and responsibilities are. From there, we will interact with them to make sure that, the union will interact with them, and we will have the process where we're obviously working with the union to make sure that they're afforded every right that they're entitled to.
It's really, I've noticed over the years, it's become the choice of the union. And, okay, they represent all employees at the bargaining table, but in a dispute, such as a grievance or something like that, that is really up to them. I know that normally they represent people who are members, dues-paying members.
Right.
I have seen cases where there's been dispute within the leadership team about, well, this is a great way to get new members, is to represent them, but on the other side, they haven't been dues-paying members, and suddenly you're affording them representation. So typically, they represent those dues-paying members in a dispute such as a grievance.
Okay, thank you. This next question is for Attorney Dupree Bruno. I think it was the next to the last slide in your presentation, it talked about emergency rule. And I think from comments and questions that I have received, people are a little confused over, we've got policy, we've got guidelines, we've got procedures, we've got emergency guidelines. If you could give us a first grade kind of, this is what we're talking about here today, as far as defining what an emergency policy is, the boundaries, because I think where people are confused and concerned is the scope, because a policy to most people is, it's hard and fast, and we run based on that, and that this is something that has come up because of something that may be temporary. So can you kind of put that into place with the emergency rule, policy, guidelines, all that?
Yes, Ms. Gittens. So what the superintendent is proposing is the adoption of policy 1.181 under the emergency rulemaking process. That process basically allows for the policy to come before the board, and if the board approves the policy, then it will become effective immediately. That policy will only be effective for 90 days. If the board chooses to move forward with the permanent implementation of the policy, then it will have to go through an additional couple of steps, which is about 28 days, to go through that process. The board approves it if it so chooses, and then it will become a permanent policy. Due to COVID-19, the recommendations from the Centers for Disease Control, the Florida Department of Health, our local health officials, the superintendent is asking that this policy move forward in an emergency fashion for 90 days.
Okay, and I think that's something that a lot of people may have seen it but didn't hear it, that this is a 90-day situation that we're talking about, and it will be revisited. The other question I have for you is, I don't know which slide, but it's Rule 1006.08. Superintendent recommends plans and brings them to the board. It is district school superintendent shall recommend plans to the district school board for proper accounting, et cetera, et cetera. I would like to say, and I've sent the board an email about that before, that in our policy that we do have that caveat in there as well in the policy, that the board be at least, updated and included. And I'm not sure the difference in this and regular emergency, what is it, 1.08, 1.18, the regular.
1.18 is the emergency powers. So the language with regards to the superintendent providing a recommendation, I think in the proposed policy that we have, which is the 1.81 that you're reviewing today and taking into consideration today, that has guidelines that the superintendent will be drafting. Now, the board can add language to the emergency policy, or when this policy comes forward for a final presentation for adoption, can add language that says that guidelines that are drafted come back to the board for approval by the superintendent making a recommendation for the guidelines, as we do for the code of conduct or the dress code policy.
And what is the timeline process then? If we're here today to look at this policy and to actually vote on this particular policy that will be for the 90 days, when do we receive the guidelines, or are the guidelines already out there, or?
So based on what Mr. Williams' teams has presented to you today, there are guidelines. Based on what you have discussed and the questions that have been posed, staff will go back and take a look to see if we can tweak the guidelines, and the recommendation will be that they bring the guidelines back forth to the board so you know what the changes are to the guidelines. In terms of the permanent policy, if we add that language that says superintendent will draft guidelines and then come back and present those guidelines to the board, as we do with other things, then the board will go ahead and have an opportunity to approve those guidelines. Does that answer the question?
It does, and I'm just trying to get it straight in my head, the policy. So if we do the policy, what they have presented is more or less guidelines as to how this policy will work, correct?
For this, and remember that the policy that the board is considering today is a global generic policy. This is not a mask policy.
Right.
This is a policy for protective gear based on what medical professionals are advising.
For this particular time that we are in.
Exactly.
Okay.
So
I
for this
just wanna
particular
make sure we
time,
get
they
that.
have developed guidelines that address COVID-19 specifically.
Okay, I just wanted to have that clear so everyone understood that. And I think that's pretty much all that I have. I just want to make sure that everyone understands it's not, and like you said before, a regular policy takes us 28 days to do, because it has to go through this process and that process in order to pass. And based on the situation we're in right now, we don't have that kind of time.
Exactly.
Okay. Thank you very much, and thank you all for your presentations.
Thank you.
Thank you, Ms. Gittens. Ms. Patrica.
I've been thinking since the email came in this morning about us approving the guidelines, and I have concerns about us voting on that because I believe that it provides or puts in place some rigidity that I think would be inappropriate given the time that we're in. I think flexibility for the superintendent and his staff, especially at the beginning of the school year, is so important. I don't know if I've talked at this table about change management, but I know that Dr. Atkins and I have talked about it in the context of healthcare. When COVID first started, the big challenge for healthcare workers was the constant change in recommendations that were coming to them. So at first they had one mask and they had to wear that mask all the time, and they had to sanitize it on their own before they came back for their next shift. And then 2 weeks later, they had disposable masks that they could get rid of every time. And then 2 weeks after that, they had all disposable PPE. And every time that changed, staff had to be retrained, new protocols had to be put in place, and a system had to be put in place to make sure those protocols were being followed with fidelity across the organization. I believe that Dr. Atkins has been warning us about a bumpy start. And I think part of that bumpy start is this. Some of this will change. And if we as a board have to meet every time a change is made to these guidelines, I think that I don't think we're doing what's in the best interest of the health and safety of students and staff. I think we need to allow this to play out a little bit before this is something the board votes on. Am I making sense to anybody? So that would be my recommendation, would be to approve a sort of a global, like you said, a global policy, allow the superintendent and his staff to put these guidelines in place. Certainly a thumbs up, thumbs down, thumbs sideways sort of approval to show support for the guidelines today, but relying on the partnerships and expertise of outside medical professionals to advise us as to when and how they need to change. Those are my comments.
Thank you. Okay, Mrs. Giovanelli, then Ms. Gittens.
Well, I'm just curious what Ms. Gittens wanted to say something regarding what Ms. Patrica said, and then I have a couple questions. I have some questions, so.
Okay.
If I may, no, I didn't mean that every time we had to, everybody now has to wear 3-ply masks or something like that. That I wasn't talking that level of detail. But the way it's written, and it says recommends plans, basically, once we've done the policy and the guidelines overarching, those day-to-day things, I don't intend to have us call a special meeting to change the size of the mask or the color of the mask, that type of thing. I'm just saying, making sure we understand what is going on and in a timely manner, knowing if there are changes, because we are the ones that get, on the front lines as far as people asking, well, what's happening here? And it's very uncomfortable to have to say, well, I don't know. And then parents are sending emails that they receive that we don't know anything about, at least I didn't. So that's what I'm talking about, not nitpicky details and getting together every day. So I just wanted to clarify that. Thank you.
Thank you, thank you. And then Mrs. Giovanni, Attorney Bruno.
I just want to clarify, Ms. Gittens, are you basically saying then we have the policy in a framework in terms of the mask policy, not necessarily the details, but at least the framework that we have a mask policy, and these are some of the things that will be guiding that mask policy?
And if what we heard today is that framework, then yes.
Okay.
And through the chair, to answer your question, Board Member Gittens, I think our office works pretty closely with Ms. Dupuy-Bruno and a lot of the implementation of a lot of these things. And so I think the goal is, and we've been dealing with a lot of different issues, but the goal is to get the information to her as quickly as it comes to us and as soon as we formulate it. And oftentimes she has input on those recommendations so that we're presenting as a united front as it relates to this process. And we're putting some processes in place to ensure that you're going to get information a lot quicker.
Appreciate it. Thank you.
Thank you.
So I have several questions. One of the questions actually is a mask mandate versus a policy, because the information that you gave us here was all Board of County Commissioners and the county. None of these are school districts. So I was curious how many school districts actually have a mask mandate or a policy. Actually, I'd like to know both of that information, because I'm trying to figure out what's the difference between just a temporary mask mandate versus a policy that sets this in stone. And so that's my concern, because we asked parents to pick where their child was how they were gonna attend school, and that was before we mandated masks. And that information came later, and that is what's upset all these parents, including my own daughter, who made a decision and then was rethinking her decision. So that makes this a bumpy start. Just that in itself becomes an issue. And that's why you get upset parents, because I know this is a very fluid situation, and I understand that. And it's changed from March 13th to now, things are so different. And Ms. Patrica brought that up regarding, what's acceptable in a mask. So I think setting a policy concerns me, because, are we going to start having to wear masks because of swine flu? Because if that's the case, I should have a whole suitcase full of those, because I got the swine flu. So, bird flu, are we going to start making everyone wear masks because of those situations that's happened in the past? So I think that the policy needs to be very clear. Right now our mask mandate is technically open-ended, and that's an issue that parents want to know. Is it going to be based on a percentage of positive cases that's going to determine that, hey, tomorrow we can throw these away? Or is it going to be based on, the government, or the state? I mean, our own county did not set a mask mandate. So that in itself, I want to protect our students and our teachers, and, I just want to make sure that all sides are heard, and that it's important to hear all sides. So can you answer the mask mandate versus the policy for me, please?
Yes, Ms. Giovanelli. With regards to the policy that is before the board at this time, it is not a mask policy. This policy states that if there is an infectious disease issue or a pandemic, and the CDC, the Department of Health, or local health officials say that you need to have some type of covering, be it a hazmat suit, be it glasses, be it masks, no matter what it is, that the school district will comply with those medical guidelines. That's what this policy says. Now, because of COVID-19 and the recommendation from the Florida Department of Health and the CDC, they're advising and recommending that we wear masks to prevent the spread of COVID-19. Thus, guidelines have been created to address the issue about wearing masks for students, staff, and the public that enter the school building. So it's two different things. Right. With regards to how many districts, I'll have to count, but I will tell you that a majority of the districts are either mandating masks or highly encouraging masks. I don't have the exact number. I don't know if the staff attorneys have any specific numbers. I'll have to count it because I have it in front of me and I can tell you the exact number, but it's a majority that are requesting some type of facial covering.
I would agree with that.
Well, we have 67 counties, and I think it's really important for the community to know how many really are, wearing masks and I understand the recommendation, but I think it's important for the community to know, that. So I think that
we're gonna count it up for you, and we'll tell you the exact numbers.
Okay. So and then
I do believe. Sorry to jump in here. I do know that the Superintendent's Association did provide that information, if we didn't already provide it to the board, we will go ahead and resend that. I'm not sure if it's the most up-to-date, but it did give you a pretty clear picture that, as Attorney Dupree Bruno indicated, the majority of the districts that are out there have a policy or a mandate across the state of Florida in effect. I'll look for it while we're here, and if I find it, I'll send it to you.
Great. Let me see. The other thing that I had some teachers contact me as well, and they're concerned, of course they want the mask mandate, so that, they want the mask, so that's not the issue. The issue is they said, we are following CDC guidelines, but yet we're not social distancing in the classroom. So they feel like that's really important that if we're going to listen to the medical professionals, we, adhere to all their guidelines. So that's the other issue that they're very concerned over because it's some classes they're unable to actually social distance, and that's important that we should figure out because I'm hearing that teachers are being laid off, and if we have these teachers, why can't we spread things out where we can social distance in the classroom? So that's the other question that I have.
If you'd like, I'd try to respond to that for you. A couple things. One is I did go out, as you know, and toured some classes yesterday, and by and large, the ones that I saw, socially distanced, that was certainly something that they were able to do due to the class size. There were some situations where that wasn't as possible, and what the good news that I have to report is that we have been able to procure those shields that kind of wrap around, so a lot of our teachers were starting to employ those, so that was pretty reassuring. Like I was in a class where this classroom space was relatively small because it was a media area, so they just had all that equipment, but the kids had these surrounds around them, so it was something that I think that we're going to see more and more of moving forward. I was quite surprised to see just how many were actually out there. I knew that they had made a strong effort on Thursday and Friday to deploy those. Some of them were deployed but still had the blue stuff where they need to take them off because they'd just been put out. But that is what we're doing when we can't socially distance. But again, I will have to tell you, and I was going to say this at the end, but since you brought it up, I was very, very, I shouldn't say pleasantly surprised because I felt we were really, really prepared. But the things that the schools were doing in the cafeterias, for example, to split shifts where they're using gymnasiums, where they were taking tables and making sure like cafeteria tables were faced in one way, so they were split, and so you had students spread out more than 6 feet, facing one direction, having half of the lunch shift in the gymnasium where they had, tables set up, all of those type of things, so that we were able to follow those guidelines the best we can. And again, most of the cases, the populations were under 50%, so they were able to do that. There were some cases where, a couple where I saw it was tight, but again, you had other things that they did to try to keep those kids safe.
Yeah, and actually, I have to say that overall, though, I mean, I didn't have really a bad complaint other than there was issues with the internet, and that was expected. But I mean, honestly, everyone couldn't believe what a great day they had yesterday. So I mean, honestly, I was very excited to hear everything I had was positive, because I think we anticipated the worst, and it was actually way better than their anticipation. Because you just don't know, because everything was new. This is all totally a new adventure. So, no, everything was really positive, other than they're worried about the social distancing. And so,
Yes.
And they're really we're all talking about CDC guidelines and everything. And so, one guideline shouldn't be more important than another. So that's their concern. And, I mean, as well as we need to identify that, the masks aren't a perfect answer as well, because there's issues with those, and acknowledge those. And so that leads me to, how many offenses if a student doesn't wear a mask. So, everyone has asked about that, but I think, what I'm hearing is that it's not going to be consistent across the district, that each principal has the discretion. And I think that we have to be very flexible and fluid with that as well, because we're not going to like wearing these 8 hours a day. I mean, honestly, students that have to wear these 8 hours, I don't know how they're going to do it. Right now, my glasses are totally fogged up, and I can't breathe, and I want to take it off and throw it down the ground, but I can't. So, it's just, we have to really be, flexible, and we're in the business to educate our students ever how it can be. So, we have to work with everything that we have possible and making sure that we're doing that. So I thank you for your, answering my questions. I just wanted to be real clear regarding, mandates versus policy, because I kind of agree with Mrs. Patrica. I'm not sure that, the policy exactly is that important right now. We just need to keep everybody safe and do it the best our ability, and teachers. And that's the only way to learn, is if they're not safe, they're not learning. So I get it. So thank you.
Thank you. Attorney Bruno.
Ms. Giovanelli, out of 67 counties, 54 are mandating or requiring masks.
Thank you.
Thank you. Ms. Vaughn.
Yeah, I was not clear. Ms. Patrica, could you restate what you're saying, a vote versus, you said you weren't in favor of a vote on this policy?
No, I do think the policy is important. I want to be clear. I do think the policy is important. I just don't believe that this board should vote on the guidelines.
Oh, okay,
I'd like to do a consensus vote on the guidelines to show our support, and send that message to the community. But I feel that we need to give the superintendent and his staff flexibility in those guidelines, with the caveat, Ms. Gittens, that any changes be communicated to us immediately, and if there are major changes, that they be communicated to us in the way they were communicated to us today at a board meeting, as opposed to just a board update.
Okay. I just wasn't positive. I thought that was what you said, but then when I saw the thumbs up, down, I wasn't sure if you were including the policy
No,
as well.
I wanted to separate the two.
Okay.
And if I could.
Well, they are separated, though, are they?
They are separated,
Yeah.
but there was some talk through, I received an email that I did not respond to, and none of us responded to it, indicating that perhaps we should vote on the guidelines, or there should be some kind of a time frame associated with this. So I had a conversation with Attorney Dupree Bruno, and we talked about voting on guidelines. And as I thought about it, I thought that's not a really good idea. So I'm sorry if that was confusing.
Yeah, I just wasn't positive, so I wanted to clarify. Okay,
Thank you.
The other thing I wanted to address was Ms. Gittens, Ms. Giovanelli is absolutely right. The county has not enacted a mask mandate.
Right.
But I see what we're doing as being very much in line with what the county has done, which is if you walk into the supervisor of elections office, for example, or the courts, or the village of Estero, masks are required in those buildings. So to me, this is very much in line with what the county has done. This is most definitely about personal responsibility. That being said, when you're in the buildings, that's where the mask mandate or mask requirement comes into play.
Thank you. Mrs. Giovanelli.
Right, and so, and I want to clarify, so regarding the guidelines, because it is fluid, that's why you're saying not to be voting on something that sets that in stone because it's so fluid with the guidelines.
The guidelines, correct. I believe
Correct.
the policy is very broad, as Attorney Dupree-Bruno indicated, and sort of it's the skeleton and the meat is put on the bones by the superintendent and his staff. And should we get to a point as a board where we decide those guidelines need to be voted on by us, we can address that later, but given where we are right now and the need for flexibility, I'm comfortable with adopting the policy, readdressing it in 28 days, making it a permanent policy, and seeing how these guidelines play out without our approval necessary for those guidelines. Because, the Island Coast Pediatrics could learn something new next week and sit down with the superintendent and his staff and say, I can't imagine. I'm not a doctor. I can't imagine how, but we've seen it change every day. Every day we're getting new medical information. I believe we need to provide them with the flexibility to react to that and respond to that for the safety of our students and our staff.
And so I think that's what the community, their concern is, that they want to make sure that as soon as possible, when it is safe, that a decision is made. And, so reevaluating it in 30 days, well, it's saying 90, but what if we did it a little sooner? I don't know, maybe, I don't, because I first think 30 days would be better, but, because things are so fluid, but, I don't know what.
I get the sense, Ms. Giovanelli, that if Dr. Adkins received guidance from the medical professionals tomorrow that these are no longer required, he would happily jump up and down and tell us that they are no longer required and change the guidelines accordingly. That's the sense I get from Dr. Adkins. So for us to set a time as a board to come back, I think this is a constant evaluation that's taking place by staff, not just daily, but on an hourly basis. I'm sorry.
I'm hearing you. Thank you.
Attorney Bruno.
Just again to reiterate, the policy that is before the board is contingent on the CDC advice, the Florida Department of Health advice, local health official advice. So if for some reason they say tomorrow you no longer need the mask, then the policy would indicate that we will follow those guidelines and that advice.
Thank you for that.
Okay, so if everyone else has finished, I have just a couple of questions for Attorney Bruno and for Mr. Williams and his team. So first of all, as I'm looking at the superintendent's recommendation, it says that the board approve policy 1.181, emergency requirement for protective gear in response to the COVID-19 pandemic and for any future health-related emergency. And then during health emergencies, the school board will require all individuals to follow the directives of the CDC, DOH, and local health. That is different than what I'm seeing on the PowerPoint, policy 1.8181. Emergency requirement for protective gear. So the wording is different because this one on the PowerPoint does not say in response to COVID-19 pandemic and for any future health-related emergency. So that's number one. Number two.
I'm sorry, can you repeat that? I'm sorry. I really want to follow what you're saying, I'm a little
Okay,
confused.
on the PowerPoint, policy 1.181, on Attorney Bruno's PowerPoint, emergency requirement for protective gear. The wording is different than it is here on the superintendent's recommendation on my script. Because it says, in response to COVID-19 pandemic and for any future health-related emergency.
Madam Chair, I think just for clarification's sake, I think the recommendation is just clarifying the basis for why he's bringing the recommended approval of the policy, whereas the policy itself is more global in nature in the sense that if there is another pandemic or situation that would require that type of medical equipment or protective gear, that it would come into play. I think that would kind of explain the justification for the difference in the language. It's not that the policy itself is different. It's just that he's stating a basis to be more, I think, to clarify why he's bringing the recommended policy.
Okay, thank you. Then I have another question regarding the team that convenes, regarding exemption requests to wearing the mask. What would be the qualifications of the members of those teams to review the decision of a licensed health official, number one?
So from the student perspective, that team would include the equity coordinator who's trained in Section 504 and the Rehabilitation Act. It would also include a nurse. So that nurse would then most likely attempt to obtain consent from the parent to exchange information with the recommending doctor, so that they could discuss the medical condition or the disabling condition that led to the request. And then it would also include anyone at the school who may have relevant information to provide, such as a teacher or anyone else.
Okay, thank you. And then regarding communicating to the parents and the community, I saw that was something that we might want to, you were going to revisit, and maybe there'd be some amendment to that guideline. And so would there be an effort to reach those people who also may speak different languages or have a difficulty in accessing information on the internet?
Through the chair, yes. I think that we'll reconvene with our chiefs as well as the superintendent and any district staff that's pertinent, including our communications department. Obviously, we discuss these issues every day, multiple times a day. And so I think that's just a question of us getting the right people in the room to discuss how we could disperse that information. And we would definitely put that information out to as many groups as possible, including translation, so that that information can be dispersed throughout the community. I think it's just a matter of identifying where we put it that is going to get the most visibility. We're sending out a lot of information right now, and I think that we want to make sure that when we send that information out, because of the nature of it, that it's being received. So I think it's going to involve some collaboration amongst different departments to ensure that happens.
Thank you. Okay. So then, oh, yes, Ms. Gittens.
Just a final comment, I guess, about all of it. As I'm looking at the policy 1.181, requiring protective gear is like an overarching thing that if we had had this 6-8 months ago, and then all of a sudden COVID happened, then we would have been here, just been being briefed on your guidelines based on this policy. Is that correct?
Right.
Okay, so that's...
Exactly.
Okay.
Thank you. Okay. Then, yes, Mrs. Giovanelli.
So thank you for asking about the team, because that was on my notes, but I missed it. But I do have one more question. So regarding Ms. Bruno, the 53 districts that did the mask mandate, did they go to policy
That,
after we did the mask mandate?
that one I will have to look into to see who actually drafted the policy and who did guidelines. I'll have to look into that one.
That would be important for me. Thank you.
Okay, then, if there are no further questions from board members, I think it's time to move on, and we thank Attorney Bruno and our district legal team for their presentations. And now the next item on the agenda is public comment. Mrs. Dupuy-Bruno, please address the agenda item of public comment.
Thank you, Madam Chair. School board policy provides the opportunity at this point in the meeting to address the board concerning any matter on this meeting's agenda or any other matter relevant to the operation of the school district. If you completed a blue card, please put it in the basket provided at the back of the room. If you need a blue card, they are located in the hallway outside of the boardroom. The rules concerning public comment are posted at the back of the room. Public comment will be made from the central microphone in the back of the room. Please be advised that the board does not respond during public comment to remarks made by speakers. At the end of the public comment period, the board chair, Ms. Fisher, will address concerns or the assignment of any concerns or requests to the superintendent. We encourage each speaker to wear a mask during public comment. We would ask that you use the sanitization supplies, which are provided near the microphone after you speak, for the benefit of the next speaker. Speakers and those attending the meeting are expected to act in a respectful manner. The purpose of public comment is to provide feedback on school district issues. Personal attacks on individuals or abusive language are prohibited. In addition, clapping, hissing, and booing are prohibited. Speakers who fail to follow proper decorum in the chambers will be ruled out of order. Any speaker continuing with such remarks will be required to relinquish the microphone per Board Policy 1.11. The time per speaker is 3 minutes. You will find a countdown on the big screens in the front of the room. Once your time has elapsed, the microphone will automatically shut off. Please state your name prior to making your comment. Please stay 6 feet apart while in the public comment queue. Madam Chair, there are 7 speakers that wish to address the board.
Thank you, Attorney Bruno. Is there anyone else in the audience who has not completed a blue card and wishes to address the board? I see none. Thank you. Attorney Bruno, please call the first name.
Thank you. Will the first speaker please approach the microphone?
Hi, my name is Melissa Colson. I live in Fort Myers. I have 2 boys that attend the high school. My concern really is for the long-term damage that could be done. We haven't done any long-term studies of children looking out and seeing their friends with masks on. We also haven't done long-term studies of children, long-term studies medically. I've read many stories of people passing out, of some kidney problems, believe it or not, blood oxygen levels going down. All these studies on masks have been on adults, and so that's my concern. The CDC also did a study, and the WHO, they took 500 people that were asymptomatic, and they're not contagious. So my concern, and I understand, I just feel like it should be based on science, and I just feel like it's not based on science. So that's really my biggest concern, is the long-term consequences, the medical consequences, and are we really basing this on science? That's my biggest concern. Thank you.
Thank you, ma'am. Will the next speaker please approach?
Corey Dye, Kid Coral, hello, thank you, and once again for bringing the public in, and I want to thank those that value hearing our opinions even when we oppose. Diverse and sometimes drastic disagreements are in the foundation of this country and the paper that the Bill of Rights is written on. I think it's great that you showed the Surgeon General's video. While dated, let's look at some other things. why aren't you also recommending at-risk or high-risk people do distance learning? Anyone in connection with elderly people, obese people, to live healthier lifestyles? All small recommendations for a small recommendation for the legal team. When you give statutes of authority and so on, it would be very important to define those keywords and the scope of how they apply. Just like all chapters in statutes have definition section in the beginning. Keywords are key, and defining those. Keywords like health and safety. Surely and unfortunately, you can't put some people on special diets. Is this policy or your authority claim today based on the state of emergency, or are you using the time to grab more authority to just enact whatever you, as some here have said, is personal? When you see fit, if you already have the authority to make these actions, why are you trying to create a mandate giving you the authority to do it? I'm also against the idea of private companies like Lee Health and Island Coast Pediatrics being involved in writing mandates and policies governing the public, considering Island Pediatrics refuses to treat unvaccinated families, and the fact that we have governing bodies that we can hold accountable and are perceived to have the people's interest in mind. I have a letter here from a doctor, right, that states I can't wear a mask due to anxiety, dyspnea from my PTSD. Who of you here have the authority to tell me my situation or my PTSD is not real, when I doubt any of you sitting up here ever actually served your country? Lastly, I want to backtrack to our last meeting. I want to point out that the Madam Chair, you and others here sat while a board member just short of threatened a member of the public when she stated, "Oh, sorry, the Jersey girl is coming out now. Now I wish I had parked out front."
Sir.
Sounds a lot like me in a parking lot. What?
No personal attacks. You're out of order.
I didn't state any personal name whatsoever. Did I?
You may continue.
Thank you. I did not address any
You do not
individual.
have any personal attacks.
Thank you. I didn't. Let me ask, what would you have done if we had met in a parking lot? Are you representing the Lee County School Board or just some Jersey girl street thug? Lastly, I request some administrative action be taken for this behavior, or I will take my complaint to the state or the public.
Next speaker, please.
My name is Ashley Pruitt. I appreciate you using the data that the CDC has given you. I'm unsure as to why we're using outdated and old information to make these decisions. You cannot hold hostage the high-quality education that our children deserve and that is promised by this district because we refuse to comply with your baseless and unconstitutional mandates. You have told us all, wear the mask or stay home, thus removing our ability to access equitable education. I'm particularly interested now that the CDC has updated the actual COVID deaths to show a total of 9,210 in a country with just over 331 million people. With this information, how can any one of you justify forcing 95,000 students to go through all of this? What are we doing? All of the information contained in this presentation was old and is biased. There's no information from the opposite side. At the last board meeting, there was a comment made. The mask doesn't really protect the individual completely from getting the virus or the flu or any other disease. Why do we wear the masks? Out of respect. But what about respect for those who do not need or do not want to wear a mask? How respectful are you being to those people? What about the licensed physicians who have provided exemptions? They don't deserve your respect? Or are you and this school board okay with disrespecting and discriminating against those who do not agree with your views on masks? Thank you.
Thank you, ma'am. Next speaker, please.
My name is Susan Cantalupo, and I live in Cape Coral. I don't have anything prepared, but I got to tell you, just listening to this, it's a mess. I mean, I've got a son with autoimmune encephalitis and autism in the school system, back into the school system, and I had to remove him for last year. I have a medical letter of necessity that he not wear a mask, citing the ADA. And the ESC coordinator at his new school said to me, well, what are the reasons? Does he have sensory issues about wearing masks? And I said, that's the most ridiculous question I've ever heard. This wearing masks is all new. So I am not going to get something diagnosed and documented stand on my son again when I have a medical letter. And as she said, the CDC just quietly updated their numbers yesterday. We have all been played. This is horrible, and our kids are taking the brunt of this. We're teaching kids that they're going to make other people sick. I mean, Senator Rand Paul, who is also a doctor, has stated that there are no children around the world that have made their teachers sick. They are the least of our problems. And I don't understand why teachers are so concerned. Let these kids be kids. And as far as making something, like, I'm going to get my terminology wrong, but making something mandated that's going to hold forever, that'd be the biggest mistake you ever made. There's something so corrupt going on here that our kids are just getting kicked in the guts here. Please understand this. This is going to change. It changed yesterday. It's going to change again tomorrow. It's going to change again maybe in 10 days. Don't punish them. If you want to be on the liberal side and be really conservative like with this, like my mother is, wearing her mask and a face shield, oh my God. Just let it be open-ended. Let these kids have a chance to go back to normal because, chances are things are going to change after the election. And I don't want to get all political, but please keep it open-ended. This is a mess, and our kids are suffering. Please, thank you.
Thank you, ma'am. Next speaker, please.
Good afternoon. My name is Jacob Pruitt. Thanks again for letting us come in and at least give you our opinions. I hope that you consider them, value them. I want to kind of go back to the last week. We all got to speak a little bit, and it was, I think, misunderstood that a lot of us were not for the school looking out for the safety of the students. That's not at all the case. My statements and my purpose of stating that was that we should be first looking at, and I think that the Lee County District's mission statement is to provide a high-class education or a world-class education. So all while we're looking over here at this virus, you guys are not considering what this is doing to the quality of their education. Yes, we want our kids safe. That's why we're here. That's why we're here right now. But you guys aren't charged with keeping them safe. You're charged with educating them. We want them to be safe while you educate them, but it's your responsibility. What you are expected to do is educate them. If they do get sick, there's laws that protect school districts from being sued. If they get injured, there's insurances in place that protect districts from getting sued. One thing I noticed during the presentation was a whole lot of contradiction. You guys are saying one thing in one sentence and another thing in another sentence. I also heard that if a student refuses to wear a mask, they would be isolated and their parent called, but then Dr. Atkins said, well, yesterday we convinced them to wear one. That's not a good thing. If a student doesn't want to wear a mask, isolate them, call their parent. If that's what you want to do, okay. But to convince a child to do something that they're refusing to do, it's a legal issue could arise from that. Another thing that was suggested is that we're anti-teacher. That could not be further from the truth. There are teachers that you guys are refusing to listen to. You wanted to negotiate with the unions, but the unions are not representing all of the teachers. I don't think that the teachers are getting hazard pay. I don't think that they're getting any extra compensation for what they're going through. And you guys are forcing them to do a lot of extra stuff. They're putting in a lot of extra time. They love their students. They want to educate their students. And you guys are making it more difficult, not only on the students, but also on the teachers. And as far as I know, they're not getting any additional compensation for that. There's also a voucher system, I believe, in place here in the district. And that's not being offered or explained to any parents that are showing concern for this. I think that that would be a simple solution. Make that easier. Give the parents the money that they need so that they can seek education elsewhere. I think the reason that's not being addressed is because you guys want to keep the money, and I understand that. But it's not your money to keep. It's the public's money. I also think that there should be a fifth option. There's plenty of resources, $1.3 billion plus budget for each year. Dedicate some resources to the parents and the students who don't want to wear masks. Give them a building, give them some teachers, give them a place to be.
Thank you. And our final speaker, please.
Hi, my name is Joby Colson. I'm an emergency physician, and I have children in the district here also. I have some concerns about some things that weren't brought up as you're talking about the CDC. On the CDC website, it says, to be sure, the best available evidence from countries that have reopened schools indicate that COVID poses low risk to school-aged children, at least in areas with low community transmission. We should not be beholden to what the rest of the state is doing, but we should, looking within our community and what's going on here, make our decisions based on that, not influenced by other areas of the state. Obviously, there are pockets of infectivity, like over in Miami, but it's a lot less here, and it's even less in some central areas of the state. Another thing the CDC said of reopening was that of key significance, in-person learning is in the best interest of students when compared to virtual learning. So if we're going to do in-person learning, it's more than just the books. There's a whole lot of social learning that kids get by reading faces, by understanding facial gestures, by understanding what's going on with other people and being able to perceive that. You stick a mask on a kid, you are preventing them from learning that, and that's a huge part of learning that I think we're overlooking here. The social implications of wearing a mask for youth is unknown. There can be a lot of mental health or other issues going on, potentially more detrimental than getting a runny nose and having a fever for a few days, which are part of normal growth and part of the immune system development. We haven't mentioned anything about herd immunity and the positives of achieving that. We know that kids who do get infected are not that sick, so if you do have the virus and you do get it, it's going to be not much different than getting a cold and being out for a few days. In the past, you would have kids out. My kids would tell me that half their school class was out because of sickness from the flu or during flu seasons or the winter. What are we going to do then? How are you going to differentiate a kid who has the flu and can come into school, but a kid who has COVID and can't come into school? So I'm a little concerned about how we're pushing this around, how we're making this more burdensome on our kids as opposed to giving them a more open environment to learning. If they choose not to want to be in person, that's a different thing. You have set up options for them. But I don't think mandating our kids to wear masks is going to be a good thing due to the low infectivity and the lessons learned that they will not be learning around the social implications and how to read people and what goes on in the social interactions that you normally have. If you are going to consider it, then in the public halls or in the hallways, obviously would be a place, but if you're sitting in a classroom and kids are separated, you don't need to have a mask on at that point. Thank you.
Thank you, sir. Are there any, did I miss any speakers? Please come forward. Thank you.
Hello, everybody. My name is Daniela, and I wanted to speak to you guys today about the mask mandate again, although we are calling it a PPE recommendation at this point. There's some varying information. One of the things that I wanted to say is that we had a SARS pandemic and a H1N1 pandemic, 2002 and 2009. And during those times, we proceeded life as usual. We have teachers that taught their students. They had people that were out because they were sick, and they went ahead and took care of themselves. During that time, there was no emergency order put in place for that specific moment or for schools or education systems, for government systems to handle differently in the future. The ramifications of those viruses were much larger, especially like the other speakers have said with the new CDC numbers that have been published. The state of emergency expiration is coming up. The way that Governor DeSantis spoke yesterday, it does not seem as if this will be getting re-executed. So I would like to ask the board to reconsider this again, to vote when the mandate, vote on the mandate after the governor renews his state of emergency, rather than now, considering it will be less than the 90 days that you have proposed for this order. I'm concerned with the 90-day order as well. We had heard about the 90 days, but we also heard that everybody would rejoice and throw their masks away as soon as they said that it was okay, whatever those parameters might be. So I also have the question about compliance versus care. It was brought up to us about respect. I don't wear a mask not because I'm disrespectful. I wear a mask, or I don't wear a mask because I'm not disrespectful. I don't treat people with disrespect because they choose to wear a mask, and I don't want to be disrespected because our medical professionals advise us that we are not to wear masks and they would not be a benefit to us. So I wonder if the people that are wearing masks, if they're doing it because that's what they feel that they're expected to do, or if they feel that it's because of care and concern and after their doctor's orders. Many people in the state of Florida, especially the city of Cape Coral, Lee County as a whole, do not have doctors here because we are not a medical epicenter. We do not have a lot of people here that go ahead and take special cases. Many people have to travel 2 to 3 hours for medical care. So making a mandate for local doctors to have a requirement to go ahead and make the letter would be unreasonable, unfair, especially since there are doctors locally that you do not take specific documentation from. Discipline methods definitely need to be addressed because although there are different situations for the district as a whole, the grade levels are going to dictate that as well, and there should definitely be leniency. And again, with the direction, it should be more of an education and not propaganda. And we need more people on the board that are going to give more of an overview of direction rather than one. Thank you.
Thank you, ma'am.
Thank you.
Madam Chair, there are no more speakers.
Okay, thank you. We appreciate you sharing your opinions with us, and the information that you included is very important. Our superintendent and staff have been working diligently to take everyone's needs into consideration, and we have created options because of that, and we appreciate all of the additional information and the timing, and we'll look into that. And I don't know if, Dr. Atkins, if you have anything further to add to that.
Well, one of the things I think that we have to stress in terms of importance, because I know there was concern that was expressed relative to guidance being from not just necessarily local. I think the predominant opinion that we take into consideration is from our own local Department of Health. That's who we work the most closely with when we are making these types of decisions and recommendations. When we have questions, that's usually the first stop for us in terms of where we get advice from is our local health, Department of Health. So hopefully that helps. I do appreciate some of the speakers' comments regarding the fluidity and the dynamic nature of this situation, which is why, believe me, I am also one that would want to reevaluate this as soon as we possibly can. I miss yesterday when I was out in schools. I miss seeing the smiles of the kids and the facial expressions as well. I mean, that's just me being candid with you. So, and this isn't the most comfortable thing in the world. And I've had concerns with board members about different instructional models and the ability for us to educate as best we can. I think we do a great job, but there's we do the very best. I think when we have most of our kids, in that face-to-face model, and that is certainly what we hope to see in the very, very near future. So we will be monitoring this situation, and we'll be adjusting as we see fit in collaboration with our local health department.
Thank you. Okay. At this time, we'll move on in the agenda to the superintendent's recommendation. Dr. Adkins.
The recommended action is approval to adopt policy 1.181, emergency requirement for protective gear in response to the COVID-19 pandemic and any future health-related emergency. During the declared health emergencies, the school board will require all individuals to follow the directives of the Center for Disease Control, Department of Health, and local health guidelines as related to protective gear. Guidelines will have to be followed by the public, staff, and students on any school board district property effective date. The adoption shall be September 2nd, 2020.
Thank you, Dr. Atkins. Board members, is there a motion to approve the superintendent's recommendation that the board approve policy 1.181, emergency requirement for protective gear? Moved by Mrs. Morgan and seconded by Ms. Vaughn. Any discussion?
Do you want me to say we move the adoption?
Yes, please.
Okay. I move we adopt policy 1.181. Oops, now I can't read it because somebody put the thing up on my screen. I can't read it. They put the approval, oh, thank you. Approval to adopt policy 181, emergency requirement for protective gear in response to the COVID-19 pandemic and for any future health-related emergency.
Thank you, Ms. Morgan, and seconded by Ms.
Vaughn.
Okay, and discussion, Ms. Gittens.
I just wanted to make one statement that this is not a mask policy, that it's an emergency requirement policy that will, if something comes up in the future that we have to wear helmets because things are falling from the sky, we revisit it and the policy is there. So I just wanted to make that statement.
Thank you, Ms. Gittens. Any further comments? Mrs. Giovanelli?
My only concern is that the policy doesn't allow for the school board to really look at it. It'll be in the hands of the superintendent, and then we would have to, so our authority of power, it kind of shifts back to the superintendent to make that determination. So, right? Am I understanding that correctly?
I think what Ms. Giovanelli is referring to are the guidelines. And perhaps, Madam Chair, if I may read the actual policy just for clarity.
Yes, please.
Policy 1.81, emergency requirement for protective gear. Where the district is confronted with a health emergency, including pandemic and infectious disease situations, which might require or warrant the wearing of protective gear to include masks, shields, glasses, hazmat suits, or other coverings pursuant to guidelines, directives, and/or advice issued by the Federal Centers for Disease Control, the State of Florida Department of Health, and/or other local health officials, those guidelines and/or directives will be followed. The purpose of the protective gear, masks, shields, glasses, hazmat suits, or other coverings is for medical and safety reasons only. Procedures or guidelines related to the use or implementation of the protective gear on school board property will be established by the superintendent and are incorporated by reference herein. All individuals entering school board property shall abide by the guidelines established by the superintendent. And I believe that is the part that Ms. Giovanelli is referencing, the guidelines that will be established by the superintendent. My recommendation is, since this policy will be moving towards, depending on how the board votes today, if this policy moves forward towards permanent policy, we can tweak the language to include upon board approval if it is the board's desire at that point.
Thank you, Ms. Bruno. Any other comments? Okay.
Well, Ms. Fisher, I agree with Ms. Giovanelli that something needs to be in there about the board being involved or informed, and I'm not sure. It's not like we had the conversation already about the guidelines, I get that. But somehow or another stating that we need to, established by the superintendent and the board informed, or I don't even know the legalities of how to say it, but.
Thank you. So, Attorney Bruno, I think you said before that this policy would be in effect for 90 days.
This policy would be in effect for 90 days if the board approves today, and then we will present the board with a more permanent policy, and we could include some language that would have the board review and approve future guidelines for future events.
Okay, thank you. And so then, for this policy being adopted today for 90 days, but it doesn't indicate that in the language?
It's in the notice that we publicized about this
Okay.
particular policy. It is done under the emergency rulemaking process under the statute, and it's clearly indicated in that notice.
Okay, okay, thank you. Any other, yes, Ms.
This
Jordan?
is just like the one that we had months ago for the emergency.
No, what you had months ago was, I believe, a resolution.
Right, I'm
This-
saying where they came back, had to come back after a certain amount of time.
Well, this would be an enforceable policy, like an ordinance, like a city ordinance that's enforceable, that will be in effect for 90 days. And then if the board decides to move forward with a permanent policy, then the permanent policy would replace that and will be a permanent policy.
Thank you. Any other discussion? Okay, then, in that case, please record your vote. And the vote is unanimous, passes 7-0.
No, it's not.
It is not.
I believe it's 6-1, Madam Chair. There's one no vote.
It's 6-1.
Can't see. Okay, the vote is 6-1, and it passes. Thank you. I don't see the no.
Madam Chair, is it possible to get a consensus on the guidelines that were presented today?
I was going to ask for that during my board member comments.
Yeah. Okay, so then moving on to the guidelines that were presented by Attorney Williams and his team. Moving forward on those, we'll look for consensus. Thumbs up for moving forward with that.
Madam Chair, if I may, could I amend that a bit to ask for consensus with any changes being updated, with any updates or changes being communicated to the board as soon as possible, and any major changes being briefed to the board?
Yeah, I was going to say pending amendments, but okay, that's fine. Thank you. So all in favor of moving forward pending any changes or amendments being briefed to the board? Thumbs up. Okay, and that vote is unanimous. Thank you.
Madam Chair, could you please confirm what number you got for the consensus, because we
Yes.
could not see all the thumbs?
Okay, 7-0 in agreement for consensus. Thank you.
And Madam Chair, where will that wording be? I mean, maybe that's for you. The wording of this that we just had a consensus on, of adding the last part about the board would be,
So it will be reflected in the minutes?
and not in the document though, anywhere.
Not in the actual guidelines won't reflect the vote, but the vote on the consensus will be reflected in the minutes.
No, I'm not talking about the vote itself, and the verbiage of that, updates or whatever would be presented to the
That
board.
any amendments or updates be provided to the board, yeah, that will be included in the minutes.
Okay.
Thank you very much. Okay, moving on now to other business, board members' comments. Mrs. Giovanelli.
So I'll make it brief because I spoke earlier regarding how I heard it was a really good day yesterday. So I want to thank all the teachers and staff that made that possible, and because I know it was quite the undertaking to make it happen, and the bus drivers and everyone. So I know it'll only get better from here. So that's awesome. I do have a couple questions. Some teachers are concerned regarding the parents are changing their mind, going back and forth, and the inconsistency. It's making it very difficult for them. So they're concerned over that. And so, let me see. the classes are still quite large, and that is another issue, monitoring that. It's been quite difficult. I already mentioned earlier about the class sizes, and I'm hoping that will adjust somewhat as well as we get closer to if the students stay in the class or where they decide. I suspect that some will change and go to more face-to-face because they're having a difficult time with the Home Connect. So I think that's one of the things. Also, supplements, I've had some teachers contact me regarding supplements, that they weren't aware that if they did leave virtual, that the supplements would go away, and they can't afford that loss. So they've asked to go back to the classroom or to the school and they've been denied. And so I don't know how or come. I'm hearing that's from HR, so I don't know how that can be addressed. Because, I mean, I would think that they would go back to their school. I hear that the principal is accepting them back, so it's HR is not allowing it, is my understanding. So that is one of the things I received yesterday. Also, I just wanted to make a quick statement because I am the one that voted no today, because I wanted to make it clear that I think it's challenging, but being an elected official, I think that we have to look at all sides of and listen to all sides of it. Well, I want to send, my condolences to those who've been negatively impacted by COVID. I've had actual personal friends and family, so I understand COVID is real. But I think it's important that we need to look at all of the data, not just part of the data. And so I felt like this policy was still had some issues. It was not clear regarding looking at every information that's possible. And because my concern is there's been several pandemics and we haven't had this in place to begin with. So I'm concerned that now we're all of a sudden making a policy based on one pandemic. So I think that we need to look at the history of what has happened in the past and not change history. So that is really most of my comments. I look forward to seeing what happens in 90 days regarding the policy that the board has put in place tonight. So I just want to say that as well. I'm hoping that that we'll have a pandemic that will start to lessen and the numbers go down as we've been seeing lately, because today they're down. So I've been watching that, monitoring that actually quite closely, because I think it's important to note that Lee County is not a complete hotspot, and we have to look at everything and not just partial data. So that's all I have tonight. Thank you.
Thank you very much, Mrs. Patrica.
So in sticking with, I'm looking at our protocols right now, special meetings. Our comments are supposed to be limited to items on the agenda, comments made by public speakers, or questions to the superintendent. Dr. Atkins, I heard several questions raised by Ms. Giovanelli. Are you going to answer those during your comments, or do you want to answer them now?
It's a pleasure to the board. I've taken down what her questions are, and so my plan was to address them in my comments.
Okay.
Also, sometimes we get some, as you know, texts from my staff, from our staff, and they can gives them a little time to answer them.
Okay, great. And if I could ask the board's indulgence to ask the board attorney a question, because that's not listed here. Ms. Giovanelli, Attorney Dupree-Bruno, Ms. Giovanelli mentioned revisiting this in 90 days. It's my understanding that we will be going through the 28-day process on this policy. Is that correct?
So during my attorney recommendation, that's what I was going to ask for a board directive if you wanted me to move forward with this policy in the rulemaking process, which would be 28 days.
Okay, very good. Those are my comments. Thank you.
Thank you. Ms. Jordan.
I have no comments regarding what we spoke about today, and I do appreciate everybody coming in again and speaking on their behalfs, and I do understand, because I have multiple grandchildren that are on all different spectrums as well, so I get it. I really do get it. And speaking of the schools and we had a totally different experience with all of ours, but that's something that I will discuss afterwards regarding the different methods of face-to-face, leave virtual, and virtual. But that's all I have to say now. Thank you.
Thank you. Mrs. Gittens?
I have some as well. Since I guess we have to stick to what we're talking about here, I appreciate all of you. I appreciate the fact that you come and you speak what you feel in your heart and your mind is the right thing to do. Remember my example of the Venn diagram. And I do want to say, yes, I do want to say, though, too, we are, I hope no one takes this wrong, but somebody probably will. We're a majority-minority district. We have 60% of our students that are minorities. And this epidemic has affected minorities more than anyone else in the nation. And yes, you're right, the death wasn't, death by COVID. It was death by complications of COVID. So to say that, I've heard people, and not you guys, I've heard people say, well, go on a diet or, stop eating rice and beans and eat proper food. That's just not always the option for a lot of people. And if you have diabetes in your family or heart disease or something and it's hereditary and something as massive as COVID comes along, it's very difficult to just overlook that. So I'm just saying, remember Venn diagram. There are people that, wish they could eat, spinach and salads and vegetables every day, and they can't do it. And we talked on this board many times about starting school and the questions about it, because there are people that have to go to work, and so they drop their kids off. I saw a lot of those yesterday. It was interesting. But I just hope we look at both sides and understand that this is not, like I've said, a policy to wear masks. It's a policy that if something comes up, 6 years down the road, that we have to deal with, that we can deal with it. And I am going to take one little liberty to tell you my favorite story of helping kids into school yesterday. A little girl going to pre-K, she was dressed to kill in all of her outfit. And when we opened the door, she looked at us all, and you'll understand this, she started screaming, like, no, I'm not doing this. So one of the teachers said, well, if you pull down a little further, because you have to pick up this pass or something. So we closed the door. As soon as the door closed, she looked at us all. The tears immediately went to a smile and said, bye, see y'all. And she's thinking, okay, if it's easy as coming to school and saying hi and going home, I'm all for it. And then we finally convinced her to get out further down. But that's what we're here for. We're here about children, for children, to keep them safe and to educate them, like you said. And that's what I have to say. Thank you.
Thank you. Ms. Vaughn?
Well, I did welcome many of my teacher friends back to school yesterday, and got some reports, and as usual, they were really worn out from the day, but I think everybody is trying to stay positive. One of the things that I have been concerned about with the opening of school is that, and most of my closest friends that are still teaching are high school teachers. So this may be more prevalent in the high schools or maybe middle schools than in an elementary school. But I think every one of them had a mix in their classes, or rather, individual classes that were hybrid. And so I remember when I was on the task force, we talked about that, and I don't know what the union position is on it, but I remember at the time that Mr. Kevin Daly had come out against that kind of scenario, because it's very difficult to control your kids that are in the class, keep an eye on the screen for those that are at home, and they were reporting rather large numbers. Well, I know from my teaching experience that numbers do get leveled off. So that said, the other thing that is concerning me is I know that teachers are supposed to be flexible on all of these, or the word of the hour, agile with this, but many of them, the agility was taken to an extreme degree, because I know of people that, for instance, a friend teaching in Lee Virtual who teaches English, but the day before, the Thursday, she had no idea what English courses she was going to be teaching, and had well in excess of 200 students, and she was very concerned about that. And I think parents should have flexibility, but my feeling is that as a district, we did a really good job of putting the information out there, and now we're having, I mean, even on day one, people deciding, not for any medical reason or educational reason, just because, oh, maybe I shouldn't have picked that. And I'm just afraid that the first couple weeks of school, we're going to have huge upheavals that could be avoided if we just kind of, if we said, I'm sorry, you chose Lee Home Connect, let us know, and at the end of the 9 weeks, we can, accommodate you with that. So that's not just hurting teachers, it's hurting the kids in the class when you have those kind of upheavals, because it affects everybody, and of course it affects how the teacher is teaching. So those are some concerns, even though I place so much confidence in the great teaching staff that we have in this district. I just wanted to touch on, in general, one of the comments that was made earlier with the speakers, and it was something that was mentioned last board meeting also. And that was the comment that we are tasked to educate but not to protect. And that's something that I take great exception to, and I believe a couple weeks ago that Mr. Bruno actually stated the statute on that. We educate, and yes, we do educate on health. We talk about eating habits. Ms. Skittens mentioned some reasons why some of our children, just because of their living situations, maybe don't have the healthiest eating habits. But we talk about that. We talk about dangers, smoking and vaping and all of those things. We educate about mental health. And so we educate, and we educate about health. And to me, the whole idea of educating about mask wearing in this particular case with an airborne virus that's very transmittable, even by people who are asymptomatic, that's part of our educational process. But absolutely, we are tasked with the protection. And I asked parents, if we weren't, would we be locking doors? Would we be putting systems in that not just anybody could walk into a school? We've had so many unfortunately, we've had more than our share of active shooters. And certainly, I don't think there's any parent out there that would say, well, no, school, you don't have to worry about safety. That's our job. So I really do take exception to the idea that we're not here for not only the education, but for the safety of the children that are put in our charge. Final note, I want to give a quick update on our School Heroes Wear Masks drive that just concluded. The main part of the drive concluded on Friday. And I had set a very ambitious goal of 50,000. Now, we didn't make the 50,000, but it's going to come before we're done with all of this. A ballpark estimate, because we haven't done the actual counting down to the last masks that are still coming in. We definitely have in excess of 40,000, maybe like 42,000, something like that. In addition, we have received several sizable monetary donations, and the online through the Foundation for Lee County Public Schools is going to stay open, and so that people that want to donate online can do that. And also, we're going to keep a donation box here at the district for people who come to meetings or staff members or whomever that want to donate masks. And I'm really pleased, I'm so pleased with the very positive response that we've gotten from the public. And one thing that I think is important. Now, I live in a gated community where it's not a 55 and up, but most of the people there are retired, older people, probably 55 and up. And I've never sewed, but a lot of these people love to sew. And we have some of the most beautiful mask donations coming in from, and I dare say that there are people that don't usually come out to our district things. I think we're pulling in a whole other area from the community, and they've been very enthusiastic and excited about it, even getting special superhero material and that sort of thing. And since she's sitting right over there, excuse me for pointing, Ms. Dupree-Bruno, but I want to give a shout out to Kathy, because she really facilitated, coordinated a mass drive from the Divine Nine, the Pan-Hellenic group, and what was it, 1,600? They came in with over 1,600 masks from our fraternities and sororities. Shout out also, Adam Malloy has done a super job with decorating boxes and distributing, and I met today with him and with Kaylee Roden, and Kaylee has been, she has the community connections. So we love all of our community, and as I said when this first started, whether you donated one mask or 1,000 or more, and of course a lot of our corporate people, the Sunpost and all of those, they're able to donate in the multiple thousands. But I'm just as appreciative, and I know all of us are, for the 15 masks that a lady sewed lovingly with special fabric that she picked out for the mask. So thank you to all of you who've made this a success. It's not over yet. We're going to be shifting gears a little bit, more information to come. And those are my comments.
Thank you, Ms. Vaughn. Mrs. Morgan?
So I heard two of my colleagues say that they were concerned about parents switching schools. It was my impression, and I could be wrong, that we offered that option to parents, so for a limited time, knowing that many of them would see some of the pros and cons when they were physically in the situation that they were in. So first of all, I want to thank staff for their presentation. I think they did a great job of laying out the legal foundation, as well as the recommendations being made by state and federal governments and local medical groups. I thought from a point of view of just educating the public while we were discussing the policy, it was very well done. So thank you for that. And I also want to thank the public for coming who are concerned about the policy we adopt, because I think it's really important that the public know that that point of view was represented in this meeting and has been taken under advisement, particularly as we move forward with crafting a permanent policy. With respect to opening schools, I made the statement that I was not going to attend deliberately, and I did not. But from what I'm hearing from people, the opening has gone very well. And so I want to compliment staff and families and students, because I think that the plan that was laid out was extraordinarily well developed. It recognizes that there will be glitches and things will change on a day-to-day basis. But when people enter into a brand new situation with a great deal of confidence in the people who are putting the plan together and the people who are in the classroom and in the schools, know what they're doing, know they have a plan, and know that there will be differences and difficulties, but they are surmountable because essentially everybody is following the same program. So I just want to compliment staff and families and students because I think they have felt confident walking into this situation, and I think the success that the district has had, at least on the first day of school and probably on the second day of school, reflects that. So thanks to everyone. And those are my comments.
Thank you very much. And we are here to educate the whole child. And I had an opportunity to attend several of the schools yesterday. And I have to say that since March, our work has been a work in progress. And our staff, our students, and our parents have all worked together to get us to the point we're at now. So yesterday was a wonderfully, surprisingly smooth day, and I saw that some of those kids were smiling under their masks, and we even did a little lesson with some of the kindergartners about how you can tell when you're smiling under the mask because you can see the eyes. So I want to appreciate also our board attorney, Kathy Bruno, and Mr. Williams and his district legal team for the work that they've done along the way, because I know it's been a lot, and there have been a lot of different issues that you guys have had to research and come up with some really good answers, and I really appreciate that. So the presentations today were great, and our policies are our part in taking care of everyone in our district. I just want to say that as we continue to monitor this constantly changing situation, I'm hopeful that soon I'll go back to another school and see all the kids and be able to see their smiles and not have to really look at their eyes. But I think that we've had a tremendous amount from the security, for security from our community. So I want to thank all of our stakeholders, and let's just keep on moving forward one day at a time. So, Attorney Bruno, comments?
Yes, thank you, Madam Chair, but I did see Ms. Jordan had her hand up.
I did have something to say.
Oh, I'm sorry.
That's okay. The only thing I wanted to say is that I'm hearing everybody, I know we were not speaking on anything but what was on the subjects. However, everybody's talking about what the positive, everything was so positive yesterday, and it sounds great, but we have to remember too, and be realistic, that there were quite a few glitches that took place yesterday as well, and with the Lee Virtual and the Lee Home Connect. So we need to make sure that the parents understand that we are working through this, because I know, for instance, people were waiting for, phone calls from 9 o'clock to 1:30 in the afternoon just to get through on Lee Virtual. And Lee Home Connect, the kids were disappearing, and the teachers didn't even know they were gone. But again, I understand that it's all new, but we need to make sure that we're, if we're being honest about, how great everything is, we need to make sure we understand that there are glitches, and this is something that we are working through, and it's going to take time for all of it to take place. Thank you.
Thank you. Ms. Giovanella?
So, and that leads me to one more question for Dr. Atkins, and I have to also mention the fact that I think we have to be, I know this is strictly a meeting that was a special meeting, but we have to be respectful of other board members and not be passive aggressive and allow them to, because school just started, and allow people to actually, I have teachers that are ask a lot of questions, and those need to be heard and answered. So one more question for Dr. Atkins is the fact that one of the teachers sent me a message saying that they're being told that if they've been exposed, they won't be told that they won't be exposed, but I don't understand how that can be if you're going to contact trace. So I don't know why they're being told that they wouldn't, if they have a confirmed case that was been in their classroom, if they're not, I guess, within the, they're told that they're not within the rule, the 3 feet, 6 feet rule and all that kind of thing. So if you could address that, and you may not be able to address it at the moment, but I think it's just all about communication. And like I said, or like Ms. Jordan just mentioned, there's a lot of things that's got to happen. It's going to be a little bumpy. And so, but I think all in all, it's a start. So thank you.
Thank you. Okay, Attorney Bruno, your comments, please. Thank you.
Thank you, Madam Chair. At this point, I would like to get some direction from the board as to whether or not you want to proceed with Board Policy 1.181 and making it a permanent rule, if you want me to move forward with that rulemaking process. And based on the discussions and comments today, I was thinking of tweaking it to say that instead of what it says now in terms of the policies, the procedures and guidelines will be established by the superintendent, that it says that the superintendent will make recommendations for procedures and guidelines, which will be approved by the board, with the understanding that the specificity of those recommendations will be on a case-by-case basis, so that there's some flexibility.
The understanding what?
With the understanding that the specificity for those recommendations, the guidelines, will be on a case-by-case basis, so there's some flexibility.
So do we need just a consensus?
If I can get a consensus, then I know how to move forward.
Yeah. Do you need to call it, Madam Chair?
We're just giving our guidance. We're not
Okay.
to anything.
All right.
Just to be clear, Madam Chair, I just want direction from the board whether or not I should, one, proceed with the formal rulemaking process for Board Policy 1.181, as well as the tweaking of the language to reflect that the guidelines will be recommendations from the superintendent to be approved by the board, with the understanding that the specificity, how specific those guidelines will be, is on a case-by-case basis to make sure that there's some flexibility. That part doesn't need to be in the policy, but that's just for the board's understanding.
Okay. Ms. Morgan, did you have a comment?
Yeah, so my comment is, I support going forward with the policy. I'm not sure I understand or support what you're saying with respect to an amendment to the policy. So I guess what I'm saying is, I'd like to move forward, but I'd like to have the opportunity to weigh in on your second piece without saying yay, having us say yay or nay at this point.
Okay, so what?
Can I just ask then, if we do give consent for you to move forward, it's still going to come back to us again for approval. So this is just moving forward when she brings us back the the next writing of it, then we still have an opportunity to weigh in at that point. But this says we go forward.
Okay.
That's what it says. So thumbs up. Yes, Ms. Vaughn?
I was just going to ask, you're pretty specific on how that language would be, but can we have the original and then what you just said for consideration? I'm tending toward staying with the original, but I, like Ms. Morgan, I would like to see exactly how it looks laid out in black and white on paper. So is that possible? We can
Absolutely.
Okay. So, yeah.
Okay, then. Thank you. Okay, it's unanimous. 7-0. Attorney Bruno, do you have more comments?
No other comments? Thank you, Madam Chair.
Thank you. Dr. Atkins?
Okay, let me just kind of start out by addressing some of the questions that board members raised. The last one regarding notification of a positive case. In those cases, remember the Department of Health does the contact tracing and also the notification. So they would do that. It would not be the school district that do that, but what we are doing is notifying our community if we have a positive case at a particular school. So we do send a notification out to that particular school. So in that case with the Department of Health, if that person came into proximity and was within, the proximity or was exposed to a point where they deemed it, that they deemed that to have a contact that would suffice in taking further action, they would do so. If not, they would not. So again, notification by the Department of Health, contact tracing by the Department of Health. Okay? And I can have, Beth With go into that a little bit more detail at another time if we'd like. But that's, I know she's done that in the past, so I didn't want to bring her here today. She's at the COVID task force hotline right now, so that's where she has been. The other is we had some questions regarding class size, supplements, and I'll address those. First of all, as it relates to class size, one of the things that Dr. Pruitt made sure that I mentioned was we haven't, quote, laid off teachers. We have had some teachers that have been moved to different assignments, and she, when I talked to her this morning, indicated that over the next 2 weeks they'll be continuing to make some movements, and she thinks, I know Ms. Bond mentioned in the email about the dust settling, so that's our goal for when all that dust will settle. We did give parents in our Lee Virtual School a September 11th deadline for moving back, and that has necessitated some staffing changes. I did see, for the most part yesterday, when I looked at class sizes were in pretty good shape. What I saw face to face, I did see a couple of exceptions that I know that budget and HR are working on, really one exception. I do have family members, as you know, that teach within the district, including my daughter, who actually does have a class size of 40, 20 that are in front of her and 20 that are online. So there are those hybrid situations that are taking place out there. To address the union's take on that, part of our memorandum of understanding is that would be something where it would be the teacher would be, they would agree to do something like that. They wouldn't be required to do something like that. So again, there is a remedy if we have a situation where a teacher did not agree to that, because it is in a memorandum of understanding. Yes, you had a question?
I just wanted to make a comment on the class size then. What I've heard from several teachers doing the Connect, the difficulty is when you're doing Zoom, you can't see a certain number of students, and their stories. I'll just leave it at that. But the class size of Connect really has to be considered because it's, in some cases, it's pretty large.
Right, and that's one of the things that principals have been working with teachers on is the class size of Lee Home Connect versus face-to-face. Now, one of the things that teachers predominantly were wanting a lower class size in front of them. And so, particularly at a high school level, I know that they wanted, if they were going to have a higher class size, that would be with the Lee Home Connect. And yes, and the problem is seeing everybody on the screen. I was doing the interview yesterday, as you know, with the Harns Marsh Middle School, the Lee Home Connect example, and one of the reporters asked, well, it looks like you only have 3 or 4 kids in that group. I said, no, I mean, they were sharing the screen, right? And so I did at one point scroll through so they could see the number, but I said there's a lot of other students, and so it does give it some challenges, in terms of being able to see everybody at one time.
And then we have to realize that this is their age of technology.
Yes.
I will not say anything further.
So, that is something that we certainly have to be mindful of. So anyway, to sum that all up, we do see that will be a continued need to balance some of those classroom situations, where particularly between the Lee Home Connect model and the face-to-face model. Human Resources and our Business Services Division have been working to actually open up and hire. So we're now actually back into a hiring mode for teachers. We feel that we can do that to meet some of the needs. So HR is actively hiring right now. So I think that some of these situations that you see, and normally, and I just need to say this is a kind of a sign of the times, normally, when Dr. Desamores and I talk about this with Human Resources, I say, all right, let's err on the side of over-hiring, okay? And that way, you have seen our last few years here, we've been in very good shape at the very beginning of the year. But Dr. Pruitt indicated today that we have taken a more conservative approach for reasons that we have discussed with you all, with concerns about the budget moving forward. So as a result, we've been a little bit slower than we normally would be to open up that hiring process. Again, that is, I think, the year that we find ourselves in. That's not our normal operating procedure, but they are hiring right now. So some of these situations that you hear about will be addressed. I was talking to a principal yesterday, the one at an elementary where I saw a little bit larger class size than I was accustomed to seeing in our other situations, even within her school. But she said that one she felt was going to be probably addressed in the very near future with HR and budget. They were working with her on that issue. Supplements. So there are supplements being paid in situations where they are continuing to earn the supplement, even if they're in a virtual environment. Example would be the ESE supplement. So that one, if you're an ESE teacher teaching at Lee Home Connect, you would still be receiving the ESE supplement. If you're in a situation where you're not performing the duties that are assigned to that supplement, then that's a case where you would not be receiving dollars for that supplement. Now, I think I'm under the understanding that you had a situation where you had a teacher that was at a particular school, left and went to another school, I believe, and that school was a turnaround school and the other assignment was not a turnaround, and then wanted to go back. And as I understand it, again, leaving a turnaround situation, we no longer earn that supplement. Wanting to go back, and again, that's where if there's a position that would allow that, you would go back. If not, you wouldn't be able to go back to that position. So that is, I believe, the case where you receive the email, and in that case, the person would not be performing the duties to earn that supplement. Supplements, many of them had not been turned into payroll anyway, so had not been signed off on, so they weren't even documents that were executed. It may have been when I left at the end of the year, I would be receiving this, but the assignment has changed, so I would no longer be assigned that supplement. Let's see. I think that is it. Ms. Jordan, the situation you were referring to about Lee Home Connect and all of that, I know Dr. Spiro has a meeting with Trey Davis coming up, so he will be working with Mr. Davis on that particular situation. And I think I addressed all those issues, other than to say I have or in the process of sending you. I asked Melissa to send it. Just kind of a summary, read it if you want or not, about, just basically our observations during the first day of school, where we went, what we saw, just to give you an idea of what the first day was like. I think overall I was very pleased with what I saw, in terms of our school staff. The students it was awesome to see students again, to be honest with you. It really was really, the kids coming into James Stevens were probably my biggest highlight. They were just really cute, because you saw a lot of the parent, kid, those parents dropping off those kids at school with the little masks on coming into James Stevens. It was cute as could be, and waving goodbye and taking pictures and all that stuff. So it was really neat. Staff was really hard at work making sure they were in the right place. And I mentioned, seeing the first student, dropped off at at Gateway High School. That was kind of historic. So anyway, read that if you'd like, if you have any questions. It does also address some of the concerns and issues that came up with email, and also with focus and with phone lines. So any other questions, send in my direction. That's the end of my report, unless there are any further questions or follow-up.
I just wanted to clarify a question that Ms. Giovanelli had asked. She indicated that we had had layoffs. That was the first I had heard of that, and I didn't hear you address that specifically.
You did.
Yeah, just
I'm sorry.
to reiterate, again, no layoffs.
That's all I needed to hear.
I just want to make sure where that may have come from. I do believe there are situations where a person had an assignment at a particular school, and that assignment was no longer at that school. So, I've been told and believe that we haven't, laid anybody off, so to speak, and we're actually in a hiring mode.
Right. Okay.
Yeah,
Did see
and
she had a
actually
follow-up.
That came from other teachers that are around that. So I don't know if they don't know what happened to that person. So I'm just repeating what they said. And actually, I can add one more to your list as well, because they're mentioning, I guess that the monitor only shows 25 students, so they can't really monitor past that, and they have more than 25 on their Home Connect. So, and there's some kind of progress monitoring weekly done, and so they said that that's very difficult to do that one-on-one. So I don't know if that's something else Trey can assist on, but I want to just bring awareness to that as well.
Okay.
Thank you.
Thank you.
I'm just going to add to that. I observed a teacher doing Home Connect, and her screen that she was using was very small. So I don't know if that's part of the issue, or if the capacity is only 25.
I don't think that some of it may be a Trey issue, but a lot of it is the training of, and I know it's all new, from them having the kids right here in front of them, and then having the kids on that screen, and then calling their name, and then getting Joey that's in the classroom, and then this kid's going, wait a second, I didn't even answer. Or it going blank, or they're at another schedule with another teacher, but yet they're not supposed to be there because they're waiting for this amount of time, but they're supposed to be over here. So that's not a Trey issue. So it's a lot of tweaking.
Well, it's tweaking, and I think this is a learning experience for all. I mean, we went from really a different model, if you remember, in the spring, where it was much more like the Lee Virtual School, where there's a lot of more flexibility, to now, students being required to be, online throughout the particular day, and so that comes with a different set of challenges. So it is on-the-job training, but those of you that were teachers know that you learn teaching. The craft of teaching is not really taught at the College of Education as much as it's taught in the classroom, particularly during your first year. So it's kind of like we're all going through being a first-year teacher again in many ways, but they learn quick.
Okay. Is that it, Dr. Atkins?
Just last thing, teachers, and staff that I interacted with yesterday, I'm sure this was the experience of those of you who went out. I think everybody was really pumped up to be at school, excited to be there. I did see, that same beginning of the school year energy was still there. despite the masks. And I, again, I was really, really happy with how people just showed up and went right into the protocols, like right as soon as they came out of the cars or off the bus ramp, and teachers were really, really ready. So hats off to the teaching staff and the school leadership teams. They've done a really outstanding job preparing.
Absolutely.
And bus drivers, same thing, wearing masks and everything. I was driving by one today, and they're driving with a mask on, So it's different, but everybody's really doing a great job. Thank you.
Thank you very much. On Thursday, September 3rd, there'll be 2 board workshops, one at 9 a.m. and one at 1 p.m. Following that, on Tuesday, September 8th, there'll be a briefing at 1 p.m., a special meeting at 5:05 p.m., as well as an action meeting at 6 p.m. At this point, seeing no other business to come before this board and seeing no objections, this meeting is adjourned.
Oh, man.
Yes, we get to go.